Hi, I'm Danielle, a Goshen Center for Cancer Care patient. I remember arriving at my first radiation treatment appointment, apprehensive of what was to come. I didn't know what to expect. No matter what treatment you've already had, radiation is different. It's a little quieter, a little colder than what you've experienced before. But treatment doesn't hurt. You can't smell it. You can't taste it. It's one of the most non-invasive cancer treatments, and I had surgery and chemotherapy. For me, it was less physically taxing, but a little more emotionally taxing. We're here to walk you through each treatment room so that you can experience the sights and sounds before your first day, and to show you that you're not alone when you're in the room. In your first appointment, you'll meet with a specialist on your radiation therapy team. They'll discuss your treatment plan and answer any questions you may have. The team will also gather all of the information they need to tailor the plan to you and your treatment area. This is called radiation simulation.
During the simulation process, you will meet with our therapists who will take you to the simulation room. And this is the room where we have a CT scanner. First, you will be positioned on the table, and then we will utilize special body molds to position you in a treatment position. And the important portion about the positioning is that we want it to be reproducible for every treatment. And then we will obtain a CT scan that we utilize for planning purposes.
Waiting is sometimes the hardest part, but know that your team is meticulously working on your plan. This could take around 5 to 7 days. When you arrive, you'll head down this hallway to one of the treatment rooms. Let's take a deeper look so that you know what to expect when the day comes.
The machine's name is called HDR, standing for high dose rate. First thing we do when we treat you with brachytherapy, we'll take you to the brachytherapy room. You are going to be laying down on a bed, and then we do have some catheters that are placed in or around the tumor. The next thing we do is that connect the catheters to a machine that actually delivers the radiation.
When it's time to receive radiation therapy, we all will come out from the room, so you will be alone, but we can see you, we can hear you, you can wave at us, you can say anything you wish to us, we'll be able to respond. Brachytherapy treatment typically may take in between 10 to 20 minutes, depending on what we are treating. So one of our machine called TrueBeam, or linear accelerator, the best way to describe this machine is actually if you think of a big stand with an arm attached to it. And that arm will be rotating around the treatment table.
It allows us to give you really focused radiation right to the target, and that way we can treat the tumor. But in addition, it allows us to capture what's the normal structures look like. That way we can stay away from all the normal structures that really don't need to be treated.
The treatment itself, when radiation is delivered, is not that long. It may range between 5 to 15 minutes, depending on what we treat and what kind of treatment we're utilizing. Most commonly, what I hear from my patients is that when the arm is moving around, sometimes it may pause, sometimes there are different clicks, sometimes they can see light, and they worry about that there might be something wrong with the machine. But actually what we do is that we monitor the breathing. We also have a special system in the room that monitors the positioning, and the machine is pretty smart. So if the body movement is detected, then the machine may stop.
Ethos technology utilizes machine learning and artificial intelligence to better target the tumor while sparing normal tissue. In addition, what happens is that Ethos technology allows us to redo the plan as the patient's tumor changes during the course of treatment. This is revolutionary because in the old days, what we did was we often delayed the patient's treatments over several days. Now with Ethos, we can actually do all that retreatment and replan while the patient's laying down on the table. Common fears with going through radiation include claustrophobia. A lot of our patients have a fear of being in confined spaces. With the Ethos unit, our patients find out that the bore size is actually very large. Patients are really happy that they don't feel a lot of claustrophobia as they go through the system. Ethos can help us treat all different types of cancers and all different sites of tumor. The patients can go through the entire treatment in about as little as 5 minutes and as long as about 20 minutes. This system, I think, is going to revolutionize radiation oncology as we know it. We can not only maximize our cure rates, but we can also minimize the side effects of radiation therapy that can really improve the patient's quality of life during the course of radiation therapy and also in the long run once they beat the cancer and they're cancer-free. Common fears with radiation therapy in general really has to do with what we call immobilization. In some treatments, you're going to be placed on the table with different devices that hold your body in the same position every day. Some people may have a mask that covers their head. So it is understandable that some patients may have fears associated with that. That's actually fairly common. But by having really a great team working around you, they're going to go over all these steps with you. We can see and hear you as you're going through the machine. We can talk with you and reassure you to let you know that everything is going to be safe during the course of treatment. The other thing that is expected is that we do have some lights in the room, some lasers that's going to be imparted on your body. So that's not the radiation. The actual radiation you can't see, you can't feel, you can't touch. I don't want you to be worried about that.
Your team cares about your comfort level and wants to help you through this process as much as possible. If you have any remaining questions or concerns about your first day of treatment, talk to one of your providers.